Hi, everybody. Welcome to the first grand rounds of the year. We're going to go ahead and get started. So, good afternoon, everybody. Welcome to the first grand rounds of the academic year. My name is Anne Marie Scapani McLaughlin, and I'm honored to serve as the new chair of grand rounds. I'm excited for the year ahead and for the opportunity to bring our community together to engage in meaningful dialogue around critical public health issues. We're thrilled to kick off the first Grand Round lecture series with two local public health leaders joining us today from Fulton County Board of Health. Dr. Sasha Smith, an alumni of our very own DRPH program, and Dr. Brandon Leftwich. Thank you so much for being here. And so they'll be presenting on the EEE, emergency preparedness, environmental health and epidemiology, response to mass gatherings. And mass gatherings present some of the most complex challenges in public health. They require coordination and the ability to anticipate challenges that can arise in large populations. Today's topic is particularly timely given the scale of major events that have taken place right here in Atlanta this past summer, and the continued need to strengthen our emergency preparedness efforts for future mass gatherings. With that, I'd like to turn it over to Dr. Kevin Maloney to introduce our speakers. Thank you.
Okay, I'm going to try to make this quick, but we have two today, so bear with me. So Dr. Sasha Smith, as you just heard, is a graduate of our DRPH program, a recent graduate this spring. She has over a decade of public health experience at both the state and local level. And prior to entering our program, she completed an MPH at UGA, a Bachelor of Science at the University of Alabama. And while she was here at Georgia State, I had the pleasure of serving as her dissertation advisor. And early in the program, she was tapped to serve as the chief epidemiologist at Fulton County. So even though I was her advisor, I really learned a lot from her while she was here. It was kind of a two-way street as I lived vicariously through all of the different responsibilities she has at the county, all the different outbreak investigations that she would be tapped to lead. So it was really just a joy to work with Dr. Smith while she was here. She is primarily, I would say, her expertise is in infectious disease, although with her role, it covers just the breadth of epidemiology. Her expertise is in outbreak response, data-informed decision-making, emergency preparedness, and on with the leadership at the Fulton County. I'm excited to meet her colleague, Dr. Brandon Leftwich, today. He works with Dr. Smith as, I guess, her counterpart as the Director of Environmental Health. He earned a DRPH in leadership at one of our sister schools, Georgia Southern. And prior to that, an MPH at Mercer College, a Bachelor of Science at Alabama A&M University. He has similarly been working in local and state public health for a number of years, and his specialty is in environmental health leadership, regulatory compliance, emergency preparedness, workforce development, and program management. So I'm excited for the presentation today and learn about how our local health departments coordinate with different agencies and different groups when we have these mass gatherings that really impact the entire city.
Good afternoon, everyone. Without further ado, it's a pleasure to be here, first and foremost. We really thank you all. And if you would, just hold your questions to the end, and we'll have plenty of time to answer questions. But without further ado, we'll go ahead and get started to the presentation.
Hello. Oh, there he goes. Okay, sorry. Okay, we just have to read this disclaimer. So this presentation is for educational purposes only. Views and interpretations reflect us as the presenter's personal perspective and do not necessarily reflect official agency policy or guidance. Operational examples have been generalized for educational purposes. Thank you. So we want this presentation to be a learning opportunity for everyone, and we do have a couple of objectives. So first, not many people understand what a mass gathering is, and we want you to understand that it's not necessarily about the amount of attendees at an event, but it's the capacity for the community to respond to that event. Then we want you guys to be able to evaluate how public health integrates with the planning and surveillance and responses of these events. So we have the three top programs, which was epidemiology, environmental health, and emergency preparedness. Sorry, so those are the ones that we'll be focusing on today. And thirdly, we want you to be able to differentiate between our roles and just understand that public health does have a seat at the table. We are a valued partner in these responses. But I have an opportunity for you all to think about one recent large-scale event. Keep that event in mind. And as we go through this presentation, I want you to consider how each of these objectives applies. We're tag teaming this.
So again, what is a mass gathering, right? By definition, a mass gathering is a planned or spontaneous event where a number of concentrated attendees has come together, right? So again, as Sasha said, we had a major event that occurred this summer that you all may be aware of, right? That's the prime definition of a mass event. It could be as big as that, or even think about a sporting event, right? You can also think about parades. You could think about festivals that we have. Anytime that you have a large number of people or a community coming together at one particular spot. So, public health considerations. So, why is mass gatherings a concern? Like, why are we worried about people coming together, right? You got to think about it. Anytime you have a lot of people in one place, things can potentially go wrong, and we want to make sure that we plan for it, all right? Whether it's the infrastructure that's in the area, you got to think about the food safety aspect of it, water safety, and just overall, just the community, hospitals, and just emergency response if in the event of something were to go wrong.
Oh, and another point that we wanted to make is that how a rural community with a population of, let's say, 1,500 people would respond to an outdoor festival with over 10,000 people, and you're looking at different types of campsites and food being imported, their capacity to respond to that event would be different from an urbanized community with about 40,000 people, with a stadium that has permanent infrastructure and a medical plan. So their capacities would be different, and how they would respond would be different. So next we want to talk about how our work connects with the federal framework. So the National Response Framework is where the work is organized in a standardized way by the federal government. And it's organized into emergency support functions. So how these different agencies support in a disaster or a mass gathering. We're only going to focus on two. There's 15. So ESF 6, which is Emergency Support Function 6, is mass care, so sheltering, right? We think about sheltering, managed shelters. Emergency assistance, do people need food in the event? Temporary housing, so is it a shelter or are people being displaced? And of course, human services. So I don't know if you recall, like during hurricane season, when people uh, are evacuated, those people have to go somewhere, right? So part of that emergency support function 6 determines where those people go. And then ESF 8 is where public health and medical services come into play. So patient movement, so EMS, the fatality management, the morgues. So all of these work together and they overlap to protect the health and safety of the public, to support affected populations, and also to coordinate resources. And so this is another Venn diagram just showing how our roles are constantly overlapping. So emergency preparedness, so that program really focuses on training exercises, response coordination.
And for environmental health, it focuses on food safety, water safety, and general sanitation safety. All right. What that can entail is inspections and permitting of those facilities and vendors that are coming in during a mass gathering.
And of course, with epidemiology, we've talked about disease surveillance, outbreak investigations, looking at data and trends. And so typically, surveillance is different when it comes to a mass gathering, and we'll go into more detail about that. But that's the general sense.
And for environmental health and emergency preparedness, when Sasha spoke about number 6 for the emergency supports function, you can see how emergency preparedness and environmental health ties together. Emergency preparedness, they deal with shelter safety, making sure that people have a place to lay their head, make sure that people are in a location that's safe. With that, we got to make sure that's safe food as well. So when people are in these shelters, we want to go and make sure that the food that's being provided is safe. With that, there's people who would want to come together, the community come together, want to serve food. We don't allow, in situations like this where shelters are open, we don't allow people to bring food from home. So even though people are doing a good Samaritan thing and want to, cook the famous, potato salad and bring it to the community, we can't do it, right? Because it has to come from an approved source. So whether that's a local restaurant or local food bank, that's coming from an approved source who want to provide the food to the people in the shelter, that's fine. But unfortunately, the community is not allowed to prepare foods from home and serve it to the people. We just want to make sure that we prevent any type of risk of outbreak and things of that nature. And always remember, foodborne illnesses doesn't have a distinct taste, right? So it tastes good going down, and a few hours later, a few days later, you start to feel something. So it's a good thing that people want to do the right thing, but again, there's still certain parameters in place when it comes to food safety.
And then how emergency preparedness and epidemiology kind of overlap is for surveillance during emergency, right? So again, while Brandon and his team are at the shelter, right, and they've checked the environment, EPI is actually tracking those people who are in the shelter because we know in congregate settings like schools, jails, shelters, infectious disease can transmit easily. So this is where emergency preparedness and EPI overlap a bit as far as like making sure resources are being met within that setting. And then same, food for environmental health epidemiology, during a disaster or mass gathering, food, water, and vector-borne outbreaks do not stop, right? So our routine surveillance plus an enhanced surveillance on these infections and pathogens still exist. And all in all 3 of us are working together for a coordinated response. And so this is going into more detail about how each program is supporting these emergency support functions. So again, we talked about emergency preparedness. They're the coordinators, they're the connectors, right? So they're looking at the mass care operational side and resource coordination and allocation. So they're the ones who would get contacted in the EOC about, oh, this shelter needs more toilet paper, or this shelter needs more, food resources. And then as far as like ESF 8, this is where we coordinate public health medical response. So if someone needs to be triaged to any hospital facility, we're also making sure that information and flow is escalated through the pathways in that emergency operations center, and also just maintaining an overall situation awareness. So meaning that everyone that's involved in these different agencies are getting the same information, like a situation report.
And for environmental health, for ESF 6, again, like we mentioned earlier, is about making sure that the food and the water is safe at these mass gatherings or at a shelter. Sanitation, hygiene, and waste vector concerns. If there's an event going on, we want to make sure that we're not, or there's nothing in the environment that can cause an increase of vector breeding and things of that nature. So you think about mosquitoes and even rodents and things like that. Want to make sure that in the mass settings that we have enough sanitation going on. So whether it's the porta potties and things of that nature. And then ESF 8, that more goes into the regulatory aspect of it. Want to make sure that if people are providing food, that those foods are being handled in a safe manner where it's not going to increase the chances of a foodborne outbreak.
And of course, with epidemiology, right? We've already talked about, as far as like mass care needs, EPI is monitoring illness among people that are being displaced, whether it's, for a man-made disaster or a natural disaster, if they're being sheltered. And we do identify disease clusters in these mass care settings. In addition, we're already conducting case surveillance and investigations, and typically we get surveillance data from a number of ways. Again, we're going to talk a little bit more about that. And we also determine disease control measures. So for example, if Brandon has identified, or if we detect, actually it's the other way around sometimes, if we detect foodborne illness or after case interview, and we determine it's at a particular location, and if it's a permitted location, such as a tourist accommodation, hotel, right, shelter, an outdoor event that is serving food, Brandon's team will actually go out to that facility and provide recommendations and inspect the facility. And so in all, the key takeaway is these emergency support functions, 6 is people and their basic needs, right? That has to happen if someone is displaced. And then ESF 8 is public health and medical needs. So I'm not going to go into all the detail of the incident command structure because, again, there's courses for that. But I do want to kind of just give you a high-level overview of how we're able to get all of these agencies to work together. And again, referring back to FEMA and their national response framework, there is a thing called unified command, right? And so that just means that there's one structure, there's one mission, there's one goal, but there's multiple agencies. And each agency has its own autonomy as far as the regulatory aspect. But all these agencies agree on an incident action plan, and that's how they follow the response. So this includes event organizers, EMS, your law enforcement, public safety, other public safety folks, and public health all sit at the same table. And the goal of this is to kind of prevent competing or duplicating efforts, so everyone has a role. And where public health sits, again, generally it's ESF 8, as we discussed in the previous slide. And then, of course, EP, but it can be ESF 6 if there is a reason for a disaster or someone needed mass care evacuation. But mainly it's this ESF 8. And so emergency preparedness will staff the Emergency Operations Center and have liaison roles. EH is in the field, so is EPI is also in the field, gathering data. And the information does get sent to the EOC, the Emergency Operations Center. And how all of this is planned out is going to be on the next slide, where we talk about how there's a set planning cycle for objectives for each incident, and there's an incident action plan, and there's briefings. So next slide. So the timeline, again, if you recall, emergency preparedness is the coordinator, right? They're the coordinator, they're the connector. They connect all of these agencies together. And typically it's about a year in advance, okay? So there's pre-planning operations. So they're identifying the hazard. They're identifying likely scenarios. So for example, in an outdoor event, right? They've already identified weather issues that can happen in an outdoor event. They've already identified that they're going to need some sort of security, food-related things. And then also they're going to assess the capabilities and partners. So who do we need to bring to the table? Obviously, if food is involved, you got to bring public health to the table. And it's an outdoor event, you've got to bring law enforcement to the table. And then about 6 to 9 months before, there's partner coordination. So that's where you get all these all-agency meetings. And this is where all the communication and objectives are being thought out. And then about 3 to 6 months before, and sometimes these two overlap. So between partner coordination and response structure, these kind of overlap a little bit. Because again, once you figured out which partners that you need, sometimes the objectives and the decision structure and the roles kind of change. They shift a bit. And then about a month before the event, this is when you figure out, okay, who do we really need at the table? What staff do we need? Do we need any mutual aid agreements? Is there something in line for EMS at this particular county? Do we need another county EMS to support? Patient transport if needed. And then actually during the event, this is where, again, more coordination with staffing the EOC, more liaison roles, just maintaining an operational picture. But while we're still operating, guess what? We can go back to responding and partner coordination. Because while we are actively responding, there are things that can change that will require more planning. So I would say, partner response, partner coordination, response structure, resource readiness, and operational coordination are all kind of happening simultaneously and not necessarily in the same order. And then post-event, okay, so now after the event, right, there's the after action. So what did we learn? Did we learn how to respond? Were there any issues taken, any actions taken from the issues? So this is where we really kind of make sure that we're planning for the next event from what we learned from the previous event.
All right. So what did emergency preparedness do during the soccer event? Again, a lot of pre-planning that has to go into play when we have events coming in. We have to establish the objectives, roles, and reporting pathways. Again, because when the bullets are live, so to speak, we have to have a unified structure on who reports to who and what goes to where. All right, and again, coordinating staff. Do we have enough people to withhold what's going on? Do we have enough supplies? Can the facilities maintain the amount of staff that is coming in all at one time? And as Sasha, Dr. Smith mentioned, that mutual aid agreement resources, right? Making sure that the partners are all in together on this. And again, staffing emergency operating centers and liaison functions. And again, integrating with environmental health and EPI on the findings. Okay. So, environmental health. This is my baby here. So again, what's environmental health's mission, right? Again, it's simple. We want to prevent, we want to protect, and we want to inform, right? So our goal is to prevent something from occurring. That's what we do, all right? And how do we prevent that? How do we protect it? Is when we go out and do these compliance checks of these vendors, okay? And if we see anything, we want to make sure that we inform of of the violations that we observe. So if we see something, we want to make sure that it gets corrected on site, and we make sure we want to document it, because you never know. out of temperature chicken could have been the corporate to the outbreak. So we want to make sure that we identify and we document these things. So there are 6 core functions that we deal with during a mass gathering. Food safety, as I mentioned before, making sure that these food temperatures are safe. Another big thing is employee health, making sure people are not handling food while they're sick, right? Want to make sure that they have the appropriate number of hand washing facilities, making sure that the food is coming from an approved source. Again, it can't come from grandma's kitchen. It has to come from a regulated facility if we're treating the public. Cross-contamination control, ensuring that we don't have the raw foods next to the fresh vegetables and make sure that's not cross-contaminated in any kind of way. And again, it's somewhat of it's different from your typical restaurant inspection because again, guys, these are tent vendors and structures that are not in a brick and mortar facility. These are outside in the element. So we want to make sure that we're controlling those hazards when out in the field. Water and sanitation. So potable water, want to make sure that the water is fresh, the water is clean, okay, the water is drinkable. um, Wastewater. So if we have dirty water, how do we dispose of that dirty water, right? Whether it's coming from a sink where we're washing fruits and vegetables to using the restroom. Want to make sure that we have proper storage and disposal of wastewater. Hand washing. Want to make sure that after you use the restroom, you're able to wash your hands. That's another big thing. Solid waste and sanitary restrictions at an event. So if there's trash being collected, want to make sure that we're able to dispose of it properly. So with our facilities that we regulate, hotels, as Sasha mentioned. So when we have a mass gathering coming, we have people coming from all over, right? And with that, these hotels, they have to make sure that they're built to withhold the amount of people coming in all at one time. With the event that just occurred this summer, you got to think about it. This is just not like a Falcons game where it's just happening in one day for a couple of hours or whatnot. This is pretty much a month of just constant people influx coming in at one time. So can our facilities handle that, right? Of course, they can do it for short term, but for a month straight, that was an area of concern that we had to look at. Swimming pools is another thing that we regulate. So when we're out having fun in the sun, we want to make sure that those pools are in proper compliance with their chemicals and things like that. And again, with the event space, making sure that with the facilities, well, not the facility, but the people coming, want to make sure that they have enough space to move around. Vector and environmental health hazards. So when I think about mosquito surveillance, this is something that we observe behind the scenes, particularly in our hotter months. So now, for basically from June to October, we conduct mosquito surveillance, making sure that these mosquitoes are not spreading West Nile virus and other particular mosquito-borne illnesses. Okay. Risk communication. So on-site education, as I mentioned earlier, when we're out there and we're inspecting these vendors and we see something wrong, we have to make sure that they correct it on site. We just don't leave it there. The goal is to provide education on why certain things can occur, and we want to make sure if we see something, we do something about it and we document it. If they can't correct it on site, then there's other methods that we do to make sure that they're not posing a risk to the public. And then public health intelligence. So what we reserved in real time, right? We want to make sure that we gather that information and we notify EPI, we notify emergency preparedness on our findings because you never know, it can be a missing link to something that may have could occur. So what did we do during our international soccer event, right? So for us, for my particular team, we have a department of about 50 environmental health specialists. Is a fancy word for health inspectors. We were responsible for covering over 15 different events around the county here in Fulton County. And these inspections that we checked happened daily, including on the weekends. We would go out there to check these food vendors. We conducted food safety oversight at temporary events, as I mentioned before, high volume of operators. Of course, you know, with even though we had the major event going on this summer, that was just that was the big thing, right? But there were still other events going on that we had to make sure that we covered as well. Even though that we had other things going on, we had to prioritize. Again, we have a lot of people coming into the county that we want to make sure that they're safe. All right, so we have to prioritize our regulated facilities that's connected to this event, which included our restaurants and hotels in the downtown area. All right, so with that being said, with all of these vendors coming into the city, it's like, how did 50 people be able to cover all these events? Well, as we mentioned before, there were mutual aid agreements with the other agencies around. So we had to tap into the other environmental health specialists around the state, actually. So we initiated that and had mutual aid agreements between different districts where these specialists would come up from all over the state to come support us. So one thing to remember is that environmental health it was simply not just doing more inspections because we had more vendors. It entailed a lot. We had to go out. We had to educate. We had to get things corrected on site, making sure that the structure itself of these tents and things of that nature were in compliance. So therefore, you know, it was a lot more than just conducting routine inspections. So here's the thing with this one, for our environmental health. We want to reduce the risk, right? So prevention at scale. So large crowds, we knew that was going to be a strain. Anytime we have a large crowd that's in one consolidated area, that scares us, okay? Because you're putting a strain on the infrastructure, whether it's the water system, whether it's, again, the restaurants, the hotels. Are they capable of supporting that many people all at one time? So we wanted to make sure that we were out there and being seen and doing something when we go out and do the inspections. So if we did see something, if we did see a violation, we have to identify. We have to make sure that we get it corrected on site. That was the biggest thing. You're going to hear me repeat that a lot. Corrective action is a big thing. Okay, and when we have the corrective action, we found success because we were able to educate them. No, you can't do this because of this, right? Providing that education to them. And a lot of times people just didn't know, you know. We had people coming from different areas of the country, so just making sure that they understood how things worked here in Georgia. So therefore, there would be no outbreaks, making sure there was no unsafe, you know, practices with handling food and things of that nature. No, you can't serve raw food on the street, right? So just making sure that they understood that.
Okay, the last program. Is everybody still awake? I know it's a little snoozy, but okay, we got a little technical on you. Okay, so think about your Epi 101 class, right? Epidemiology, we're doing surveillance, we're doing situational awareness, we're doing disease detection, we're doing investigations as we respond to these mass gatherings, and we also are reporting and providing data back to the Emergency Operations Center, back to some interagency discussions are happening. So starting with data collection. Data collection is probably like the core of epidemiology. I always tell my staff and students in here, if you put trash in, guess what happens? Trash comes right back out. So data collection is a huge piece. And, you know, during a mass gathering, mass response, you get data from multiple sources, multiple streams. And then we have to analyze that data, right? So is this our baseline? Is this routine, or is this something abnormal? And then once we get a detection, once we've determined, okay, this is above our baseline, we've never seen this many GI illnesses at this point in time, so let's call environmental health. Next slide. So we have to investigate, right? So environmental health goes out, investigates, reports back to EPI. And so that's when we make the determination, you know, is this a real event? Is this a real outbreak? And so the key point here is that during events like this, timely data is key to public health action. So we're spotting these detection signals, alerts early to prevent spread of disease transmission. That's essentially what we're doing. And so so this slide is just gonna talk about some of the surveillance approaches that we take during a mass gathering. And these are, we already have our routine systems, right? But everything is just on steroids, like 10 times bigger. So we have our passive surveillance. So this is where we receive routine reports from our providers. We have our notifiable disease surveillance. All of our routine providers are on alert that they need to report any and everything to us. Then there's active surveillance. So this is where public health is actively seeking information. So we're looking at the event medical teams. We're looking at medical tents, some of the healthcare facilities surrounding the events, and this is useful for rapid detections. And so this is where syndromic surveillance comes in. So syndromic surveillance is kind of like a sentinel surveillance, meaning that you have voluntary selected specific healthcare providers, and then based on the chief complaint or syndrome that the person is reporting is how we're able to detect GI illness, respiratory illness, heat, injuries, anything like that. And so why do we collect surveillance data? So CDC has a couple of frameworks as to why we collect surveillance data. So first is to monitor. So as part, at the local level, we're applied epidemiologists. So we're tracking disease and injury over time. And then we investigate, right? Because that's going to determine whether or not, follow-up is required, or is this just background noise? And then prevent. So the ultimate goal, just like Brandon, we're trying to prevent disease transmission and control. So we want to be able to mitigate everything in a timely manner. So while we have these 5 people, we want to prevent from spreading to 10. And then evaluate. So are our interventions working? Brandon, was it that restaurant or is it something else? Is it the manufacturer? Is it the farm? Where did the food item come from? And then provide information. So this is where we inform partners, we inform leadership, we're informing the EOC that yes, that employee was serving food and they had norovirus. That's what got everybody sick. So again, I'm just kind of outlining in general from when we get an alert to how we respond. So we have to confirm whether or not this is truly a signal, right? It's truly an alert. So we're looking at case details. We may even interview someone. Once we kind of interviewed the first, few people, we actually come up with the case definition and kind of determine, whether or not we're going to find cases through our routine surveillance or through our enhanced surveillance. So was it at the hotel? Was it at the outdoor festival? Like, where did this happen? And then, of course, the general person, place, time. So now we've kind of determined, some patterns, some commonality with everything. And then finally, again, we're able to work with our healthcare partners, work with environmental health and preparedness to reduce the risk and communicate actions. So what did we do during this hypothetical summer event? So all those things. We had enhanced surveillance. We had multiple healthcare data coming through so many different resources, right? And then we had priority syndromes that we monitored. So everyone kind of remembers the whole Ebola situation that was going on. So hemorrhagic fever, bloody diarrhea, those are types of syndromes that we looked at. Heat, those are things that we looked at. And we investigated whether that was unusual. And so we do have a semi-real world example. So in the news, this past summer, they were discussing heat-related illnesses at outdoor festivals. Now, while heat-related illness is not necessarily an infectious disease that we would commonly, follow up on at the local public health, however, it is a health hazard, right? And so a cluster of any illness is reportable and you have to kind of like follow up on it. And so we had multiple persons reporting heat-related illness, and we were able to, get data from, from EMS, from our hospital surveillance, because some people, the caveat to this, that some people were just able to report to a medical tent, get hydrated, and walk away. Some people had to be hospitalized, right? So both of those data sources work together. And so we were able to trigger coordinated messaging between city and county officials and even local health departments to put out heat alerts. Okay, now the fun part. So think about everything that you've learned today, and it's okay for you to share out loud who do you think leads and who do you think supports. And the most important thing is for you to know that there's multiple leads when you're working on a coordinated response. And then there may be some more supportive, function, a program that supports the functionality of it. Okay, so the first one, foodborne illness, unsafe food. What do you guys think? Okay, is it only environmental health? Okay, yep, correct. So EH leads, EPI supports, EPI leads, so it's a co-lead depending on how the outbreak occurs. Like sometimes EPI will find out first, and then there's an actual environmental factor, health factor, where it could include, more, Department of Agriculture, et cetera. And then of course, EP is supporting.
All right, the next one, communicable disease clusters. EPI. There we go.
Yeah, correct. So EPI and EP, just because there could be a healthcare facility factor involved where EP may need to coordinate resources.
And next will be water and wastewater distribution. Yeah, environmental. EP as well.
Yeah, and EPI is just supporting it. But in the event that somebody gets a waterborne illness, then EPI will probably take a lead.
Then vector-borne. I'm sorry, I hit the button too fast. I'm
Listen,
sorry.
they're trying to learn something today.
I'm sorry. Okay, but y'all got it right. Environmental health and epidemiology takes the lead when it comes to vector-borne disease concerns. Okay, here's the next one, extreme heat and crowd health impacts.
Good job. You
Good.
guys are paying attention. So EPI can sometimes, take the lead on that because there could be some healthcare, human side of things going on.
All right, what about shelter and facility sanitation? Environmental health, and there's another one too, emergency preparedness. Yep.
Good job. And so again, EPI is supporting, but in the event there could be a flu outbreak at a shelter, what happens? GI illness, noro, then EPI kind of takes over again.
All right, and then we have public health information / a sit rep.
Yes, emergency preparedness, and then of course, EPI and EH, remember, as part of the support functions, we're providing, the information, and EP is kind of coordinating that because the public health information, the sit rep, are in the EOC, Emergency Operations Center, which is part of, the incident command structure.
Good job.
Okay, and I do have a couple of things for the students. So if they're interested in any of these, information, public health trainings, there's plenty of stuff on the FEMA website for students. Also, CDC has a ton of, surveillance and outbreak guidance with all the frameworks. And so is environmental health.
Mm-hmm. Yeah, environmental health, same thing. CDC has tons of information out there in regards to environmental health.
Thank you. And now it's time for questions.
Thank you to our speakers. Wonderful. So now we do have some time for questions.
Thank you. I learned a lot. That was a great presentation. I have a question about maybe the larger coordinated response and I have two-parter. What considerations related to things like human trafficking or violence that can, erupt during events are part of the larger coordinated plan. And part two is the things related to displacing, particularly unhoused people. Is there anything that was beneficial that might be residual, like continued after this? I think I know what the event is, but after this soccer event, things that might continue to support people who are displaced.
Right. So I can touch on the part about trafficking. That's something that's um, was that actually we spoke about that prior even to the World Cup coming. That's just something that the state is really trying to put an emphasis on. So even for us as environmental health, for instance, we often regulate hotels, right? So trafficking is associated sometimes with like hotels and things like that. So even though for us, we don't necessarily we're not trained to handle that, but it's more so of a if you see something, say something, how to report it, what are signs to look for in the event of trafficking. So when we go to these facilities and we notice something, we are now trained, or we're learning certain triggers and be able to identify what's going on. So you know what, that doesn't look right. Let me report this to the proper agency, and that could possibly help save a life, so to speak, in regards to that.
And hello, okay, sorry. Um, just to piggyback off of what Brandon said, there is an app that you all can download, and it's called See and Send. And this is what they kind of pushed through the whole all mass gatherings, is an app where people can report unusual behaviors. There were, we can anecdotally speak about partnerships where law enforcement and other agencies may present at certain meetings on these things and discuss these things, but it's not necessarily public health function, but it's more situational awareness for us. So those conversations did happen. And as far as persons that were displaced, there was also planning conversations on that. But again, because it's not a core public health function, but there were resources provided.
Thank you for the presentation. That was really interesting and fascinating. Um, partnerships are an essential engine for public health, as I'm sure you all are very, very aware of. And it really strikes me as you were talking about kind of preparedness and being ready and being able to manage these very, very complex events. It's so important to have strong partnerships with law enforcement, with other county health departments, state health departments. That coordination you kept talking about is not just internal, but like with all of the people involved, health systems. So can you talk a little bit about, like when you were starting to plan for a massive event, if you don't have partnerships already established that you can build on, you're starting from well behind, even if you're starting a year in advance. So what kinds of things do you do in the health department to maintain those partnerships so that when something comes up, like you're just building on what's already there as a resource, and how do you maintain those after the end of the events, like as a core collaboration space?
Right. So the good thing is that with a lot of the sister agencies, so to speak, we work with them often, right? Just outside of the mass gathering. So whether it's law enforcement. So particularly for my department, if we have let's say a restaurant that is not in compliance, maybe they don't have a business license either. They don't have a health permit or a business license to sell alcohol or whatever. So we have a partnership with them. So that made it kind of easier for us to kind of coordinate because we already have a working relationship with our sister agencies. I think I won't say it was necessarily a challenge, but what we had to adapt to was the agencies that we don't work with on a regular basis, whereas like our federal partners and things like that. But what really helped was having those all agency meetings to get to know um, um, these sister agencies and things like that. So I may not work with another agency, but when we have these plannings, being able to sit down with them and just kind of talk some things out, different scenarios. We had certain case studies and workshops that was provided during these agency meetings where we kind of got to understand, okay, what's their role, what do they do? Oh, so you're who I contact when this happens, things like that. So it made it a lot easier during the pre-planning period to have all these people at the table, right? Um, and luckily, we had some staff members and people who've had these years of experience, so they know who to contact and things like that. They knew who the proper people to bring to the table. So for us to know who is who.
I would just like to add how are we maintaining these relationships? Well, there may be another event that's coming in 2028. Thank you.
Hello, thank you again for the lecture. I wanted to ask if maybe in the process of this cooperation that you all have together, is there often like conflict between agencies? And if you could give like maybe
Yeah.
like an example of something that may have occurred during that summer event.
We all work well together. Life is one big group project, and so it's really important that you work well with others. I think email works better than actually, I'm just kidding. Go ahead, Brandon.
No, but I mean that's a good point, and it happens, right? Hence why that unified command structure is so important to know who takes the lead and things of that nature. Now, for instance, me and Sasha, we work very closely together. Um, we do, and it could be as something as simple as when somebody gets sick, right? We get a complaint in, hey, I ate at the I don't know the Bojangles and I got sick, right? I got salmonella or something like that. So who takes the lead? Is it me, my inspectors, or does Sasha and her team go out first, right? Um, there's certain parameters in place to let you know who needs to take the lead on what, right? But there were instances in the past where certain agencies may have bumped heads, right? But we've learned our lessons from that. That was before we got in our positions, but there have been situations in the past where certain agencies may have bumped heads in certain aspects.
Just piggybacking off of what Brandon said, there is always some, conflict, but I think once you go back to the policy and to the framework, and then you have those crucial conversations, I think that kind of mitigates a lot of that, or the actual conflict, because you're like, okay, well, per Georgia law, da 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 da, I'm responsible for this, you're responsible for this. So I think that really helps, just having those crucial conversations. And again, those face-to-face all agency meetings really helped out a lot too, because we understood who was actually responsible for what and then whose support. So that's a really big thing about the incident command structure and how it helps agencies kind of work through those turf wars.
Thank you. Uh, thank you all so much. This is really interesting. I have two questions. One is about this hypothetical event that may have involved FIFA. And FIFA requires all host cities to develop a human rights plan. And I'm just curious, City of Atlanta was obviously in charge of developing that, but I'm curious if and how you all kind of interacted with either the development of that plan, but also the actual kind of like implementation of it. And then my second question is, I think these large scale events, especially in Atlanta, are really unique in that we have both the city of Atlanta as well as counties like Fulton County and
County,
DeKalb
right.
County. But then also, obviously, we have vendors coming from, Metro Atlanta, from Cobb County, Gwinnett. And I'm curious of how all of that kind of played into your all's, planning and preparedness. How do you really get into the nitty gritty of partnering with other counties and cities and kind of battling that jurisdiction?
Right. Well, to answer your first question, we weren't involved in the first part on that first question. But as far as like partnering with the other counties, so with the event that happened, this summer, it just wasn't in Atlanta, right? It happened all over, right? So for us, we stayed particularly within our county, in our jurisdiction. So if something happened in Cobb County's team was responsible for that. We were responsible for Fulton County. DeKalb was responsible for theirs. But we were all in support of one another. Um, and it was already established, yes. So when we got these support people coming in to help us, it just wasn't support from the metro. They were coming from um, all parts of the state and even other states as well. So, city of Atlanta, I believe they brought law enforcement from like Memphis and things like that. For us and my inspectors, they were more so in the state, but which made it a lot easier because of rules and things like that. But they were coming from like Savannah and the coastal districts and North Georgia and things like that because we really couldn't use the metro inspectors because they had their own fan fest going on, right? So, but it definitely made the lift a lot easier due to that. But yeah, that's
Hi, my name is Osmi. I'm a public health senior. Um, when there are mass events, there's usually like construction and infrastructure changes, like road changes, public transportation, and other things that are built, and the employees that are building them as well. So, is there any relationship between these aspects of mass events and the environmental and epidemiological departments, be it with injuries or other environmental hazards?
Oh yes, most definitely. So that was definitely a point that our organization had to take in consideration was like road work, road closures, things of that nature, because we have to get to work too, right? We have to be able to move around and get through the event. So that was something that we planned early with the Department of Transportation. They definitely had a seat at the table as well as far as like road closures and barriers and things like that. Even for us, just being able to get to the event. So, um, you know, uh, having a park and things like that. So all of that was taken into consideration. Um, I don't know what information they had in regards to saying, "Hey, we're going to close this road or we're going to keep this road open" and things like that. But they did uh, have a seat at the table when it came to road closures and things like that, and that was factors that we had to take into consideration.
Right, well, that's all the time we have for questions. Thank you all so much for joining us today and to our speakers for the first grand rounds.